Hello everyone, this is Bhim and Phinees. Welcome to our review presentation on social work home visit to children and families in the UK, a Foucauldian perspective by Corinne Winter and Vivienne Cree. So what is this article about? The author states that home visit is at the heart of social work practice with children and families. It is more than any other single activity that social workers do, except recording. Yet it is an invisible trait that happens behind closed doors and in the most intimate space. It is through home visit that assessments are made on a daily basis about risk, protection, and welfare of children. The aim of the article is to provide a critical and chronological review of research policy and practice of home visiting, drawing on conceptual tools associated with Foucault's approach to discourse analysis. The author also aimed to explain how and in what way changing discourses have shaped the emergence, legitimacy, research, and practice of social work home visit to children and families at significant time periods in a UK context. The author aimed to highlight the importance for the social work profession of engagement and critical reflection on the identified theme as part of their daily practice. Now I'm going to hand over to Phinees for the next slides.
So I'm going to look at the authors, and there are two authors who has actually made this work. And the first one is Karen. She worked as a child protection social work for 16 years. Then she became a lecturer at the University of Belfast for the past 12 years. So her research focus is basically on children and family. And she also has published quite a lot in peer-reviewed journals. And the second author is Viviene, which is, she is a retired professor from the University of Edinburgh. Like Karen, she has also worked as a social worker for 16 years, but she has been in research for the past 30 years, and her research interests include social work history. So both authors seem to have what it takes, the knowledge required actually to undertake a historical analysis of the home visit. Talking about the methodology that they use actually to present this work, this article is a qualitative design, and to analyze the text that they use, they use a Foucauldian approach. And the Foucauldian discourse analysis basically aim to explore how a subject change. He tried actually to trace also Foucault was quite very good at studying the history of things like mental health, sexuality. So that same approach has been used actually to understand how home visit has evolved for the time and different meanings that home visit has taken for the time. So in order to do that, actually to analyze how this, to do this historical analysis, Karen and Vivienne use different texts from the past. They use some legislation, they use work from experts, and they use politics from the time actually to give us an impression how home visit has evolved through the time. And the good thing about the Foucauldian discourse analysis, he looks for practice, how practice change, how power relate to what we call truth, how power actually affects things to become legitimate, for instance. He also looked at how knowledge actually can affect power, vice versa. So in that sense, the author did quite a very good job. Then we are going to talk, we're going to discuss actually what the author has found, how the discourse has changed. So Bhim, can you tell us a bit more about that?
Thank you, Phinees. Definitely. Let us discuss about the home visit. The author claimed that home visit, was talked about differently in different periods and was conducted for different themes and purposes. Um, he goes all the way back to Judeo-Christian tradition when the home visit, began, according to the authors, and it had its, religious incentive behind this. It was a way to secure a place in heaven from the well-off while supporting the needy. In the medieval Europe, home visit was conducted as a feudal obligation, for example, lords visiting their vassals. And in 18th and 19th century, home visit was undertaken by churches and volunteers providing a relief system to the poor. The author say that home visit is a friendly act to the poor, but visitors hold a greater knowledge, class, status, so that they could influence the people they are visiting, and they could encourage the needy, people who need, help, so that they could self-help. So it has a spirit of classical liberalism as well, according to the authors. So regardless of time period and the purpose or theme, through home visits or through the practice of home visit, the power relation seems always to be existed, always was there. So if you look at home visit, a means of assessing claim for help or connecting families with local resources, or even individuals with resources. And also, home visit was also used as a means of social control, throughout time, and also as a way of socializing for people during industrial revolution period. And it was used as a means to provide warning or take some punitive actions and remove children from the local authorities. And home visit is also used as a means of risk management and protection of children. And it is, according to the author, a means to assess, manage the risk and manage cases. So despite all these various histories and purposes behind the home visits, the uncertainty still looms in regards to the home visit, and the author asks, does it even work? So I'm gonna hand over to Phinees and ask the questions. Why the change over time, Phinees?
Okay, certainly home visit has changed, but there are reasons why it has changed. And one thing Foucault actually does well, he tried to attract on the context. So initially the context of home visit was a belief in God in the medieval Europe. Belief in God was very prominent. So home visit was more of a philanthropic deed for poor relief. Then there are many things that happened between that, but I'm going actually to only cite the most important. Then came the introduction of the Prevention of Cruelty to Children Act. That from that time, it gave home visit a different sort of this legitimacy. Now social work had the right actually to go to intervene in family life because they wanted to prevent cruelty against children. Then there's another change actually that came, and this came through Mary Richmond. She introduced actually the social work casework approach. This is a social diagnosis. It gave home visit a structure so that it was more systematic. So home visit was done in a systematic way. The social worker need to have a certain level of knowledge to undertake that work. Then later on, we see now the state start to regulate home visit. They create a new law. For instance, we can cite things like the Children Act. So the state provide a way of doing home visit. All of that with actually the back of the mind is to manage actually risk. So we started from a philanthropic deed to a risk management approach applied to home visit. So this is how these things has changed. And in terms of conclusion, Bhim, what do you think about the article? Do you think the author has achieved or the set from the beginning?
In conclusion, the conclusion seems to be off tangent. The author talks about the home visit as on being on spotlight in the conclusion, but they don't talk about throughout the text. They only talk about the history of home visit, and in conclusion again they talk about the welfare cards, but they never mention anywhere in the text that the welfare cards and how the the welfare cards can actually impact the poor and the social work practice. And similarly, they say like it provides a good research questions. But it seems like they are more prepared to do more research, but don't even like give a detailed detailed analysis of how the family perspectives and how changes in policy and practice affect the their spaces. And it has kind of hidden mention of power relations, in the context and evolution of a home visit, but it is not explicit. They've done a good job, overall on retracting the timeline of home visit and the mechanism that made it acceptable, by the use of Foucault's, discursive analysis approach. That is it. I think. Phinees, do you have anything to add?
Yeah, not really much. Actually, I like the article because I learned actually a lot about the practice of home visit, how it began. I didn't know before reading this that it started as a philanthropic deed to become a risk management tool. So other than that, thank you very much for listening to us. Okay, bye.